Hello and welcome to the second session of Caregiving, Thrive, Learn, Connect. Today we're going to be talking about dealing with the blues. And we're going to go ahead and get started. Let me pull up our PowerPoint. So as we go through this session, you may have questions. I'm going to encourage you to contact your facilitator, who will be able to answer any questions that you may have as we go through this material. First step is I'm going to ask you to take a moment and let's let go of everything that brought you to this point today by encourage you to take a moment to take 10 deep breaths before we get going. So sit comfortably in your chair, close your eyes. Remember your feet should be flat on the floor and arms should be supported in a comfortable manner. Try to sit so your shoulders are over your hips. This allows your lungs more room to expand. If closing your eyes is difficult for you, you can pick a place on the wall to stare at during this exercise. Take a moment, notice your breathing. Now we're going to ask you to slow down your breathing to help you relax. To slow down, do a slow inhale through the nose for a silent count of 5. Then do a slow exhale through the mouth for the same count. You ready? Let's start. Breathe in, 2, 3, 4, 5. Breathe out, 2, 3, 4, 5. Breathe in, 2, 3, 4, 5. Breathe out, 2, 3, 4, 5. Breathe in, 2, 3, 4, 5. Breathe out, 2, 3, 4, 5. Breathe in, 2, 3, 4, 5. Breathe out, 2, 3, 4, 5. Breathe in, 2, 3, 4, 5. Breathe out, 2, 3, 4, 5. Breathe in, 2, 3, 4, 5. Breathe out, 2, 3, 4, 5. Breathe in, 2, 3, 4, 5. Breathe out, 2, 3, 4, 5. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. When you're ready, open your eyes and come on back to our session here. So welcome back. So the first step in what we're going to do today is check in and see how you did on your action plans that you worked on during the week. If you remember last week, you had an option of either working on your deep breathing or working on the visualization. Well, this is a good time to stop and look back and see how you did. Uh, did you work on it? If not, what happened to stop you from working on it? Are there ways to work around it? So it's important when you make a plan on something that you're going to work on during the week, if it doesn't happen, taking a step back, figuring out what prevented you from doing that, and seeing if there's a way to make sure that next week, when you take home the skills that we're going to be teaching you today, that you can kind of anticipate what these problems are and figure out how you're going to address them. For those of you that did the deep breathing or the visualization, um, did it change your level of stress? What was this experience like for you? Is there a time when you're caregiving that you think that this skill specifically would help you to get through that experience? It's important to really anticipate things that can get in the way of actually working on these skills. And we encourage this practice of taking these skills and working on them during the week. Because if you think about it, just sitting here for the 90 minutes that we're going to be working with you isn't sufficient to really become proficient in these skills. Right? So you need to take them home, you need to practice them so that when you need it, that it is available to you for you to use. It is common for people to really plan to work on these skills, but then when they get home, life kind of takes over, and then you figure, it just never happens during the week. In that case, it's really important for you to figure out what's a good reminder for you to use. So think about what you're going to pair it with, right? So say every time you open the fridge, you're going to take 10 deep breaths, right? Because 10 deep breaths should take you about a minute. If you're driving around, every time you stop at a red light, you can take 10 deep breaths. So there are things that you can pair it with that can make it easier to remind yourself to do these activities. If you find yourself consistently running into issues, make sure you reach out to your facilitator who will be able to help you work through these problems. So today's topic, we're going to be talking about caregiving and specifically how caregiving affects your mood. And we're going to talk about one of the skills that you can use that research has shown us that can improve your mood, to elevate it a little bit. And then what to do going forward. How can you use these skills and integrate them into your life so that they're consistently useful? So let's start out with caregiving in your mood. So there are many reasons why caregiving can lead to experiencing depressive symptoms and other uncomfortable moods. Most people who become caregivers do not plan to become caregivers, right? It happens unexpectedly. Whether it was a retirement plans that you had that no longer can be done because the person that you were planning to spend your retirement with is now having an issue that you need to become a caregiver for. Or it might be that you're trying to take care of a parent at the same time you're taking care of kids, right? And this added responsibility and perhaps destruction of long-awaited plans can all affect your mood and take a toll. We also know that caregiving for someone can become all-consuming, right? It can mean long hours, it can mean high levels of stress, not enough sleep. And for many of us, it's also increasing family conflict All of this can add up and lead to feelings of just being overwhelmed. And then the severity of the disease itself, right? The more severe the disorder, the more caregivers report depressive symptoms and other negative emotions, especially when the disease is progressive. So if you have something like caring for someone with a dementia, which will get worse over time, the more severe the disease is, the more chance it is that you may experience some depressive symptoms. So in caregiving, experiencing these depressive symptoms are more common than you may actually realize. Research shows that between 40 to 70% of caregivers have some symptoms of depression. Many people who have these symptoms may not actually seek treatment for it, either not recognizing that these symptoms have a treatment, or they may feel uncomfortable, and they may feel that they're leaving themselves open to be judged, perhaps as not a good caregiver if they need help to get over these emotions. Interestingly enough, one of the things that tend to really make these symptoms of depression worse is the feel that you may have little to no control over your own life, that you feel like you're always dancing to the tune of what's happening with that disease that the person has. And this can actually make these feelings worse in many, many ways. So I've mentioned depressive symptoms a couple of times, but really, what are these depressive symptoms I'm speaking about? If you look on the orange side of the screen, you'll see a list of symptoms that fall under this category. The feeling sad. Some people report feeling empty. There are a significant number of people that are just irritable, right? Or they may, at the worst, feel hopeless. For many people, there's a loss of interest or even just lack of pleasure in doing activities that you really used to like to do. Many people report appetite changes. They may eat more or they may eat less. They note sleep changes. So either they sleep way too much, finding it very difficult to get out of bed, or they're not sleeping enough. They may feel restless, or it's opposite. They may feel so slowed down that it feels like the world is just zooming past them. Many will report a loss of energy or fatigue. Some will report feelings of worthlessness. Many people report slowed thinking or an inability to concentrate. At its worst, we hear thoughts of harming themselves. It's an important thing to note that people have these symptoms and they come and they go. But there's a difference between having some symptoms and having a depressive disorder, right? When you experience 5 or more of these symptoms every day for most of the day for over 2 weeks, you may want to reach out for help, especially if it starts to affect your functioning, right? Your day-to-day activities. You find yourself not going out. You find yourself maybe not even attempting to do any activities because it just doesn't matter. Nothing will make you feel better. At that point, it's really time to reach out and seek treatment. It's important to note that depression itself is a easily treated problem, right? You can work either with your primary care physician or a mental health provider. Treatment can consist of talk therapy, or it can consist of medication, or a combination of both. But it's important for you to realize that for many people, untreated depression rarely gets better on its own. So getting help will be good for both you and the person that you're caring for so that you can become a better caregiver overall. So now that we talked a little bit about what we're talking about when we say depressive symptoms, what are some of the things that you can do to actually help? And one of the things is taking back control with positive activities. So, decades of research have shown us that one very effective method to manage your mood is taking back this control, right? Many times, caregiving is not an activity we ever plan to take on. We come to it by necessity. At times, it can make our lives feel a little bit out of control, or at least it may feel like you have little or no control. One very effective way of dealing with this is to make time in your schedule for things that you find positive. Although being a caregiver is time consuming, it is important that you make time to do activities that add something positive to your day. If all of your activities are limited to your caregiving responsibilities, you may begin to feel burnt out, frustrated, even resentful. This can lead to depressive symptoms. You may say to yourself, "What's the use?" Or, "It seems like there's nothing I can do to make things better." When you notice that you're starting to have these types of feelings, it's time to check your schedule and add positive activities into your day. So, what are positive activities? Positive activities are activities which give you a sense of pleasure, meaning, or purpose. They can be big or small. One example might be going to see a play with friends, right? That's a pretty big activity. There's lots of planning involved. There are other people involved. All of these things create steps that may become a little bit harder, say if friends drop out, or if they start arguing about which play to go see. You can see how that could be more complicated. Or you could go for a smaller activity, right? So having a cup of coffee in the morning to start your day. So both of these are considered positive activities. They may require some planning because they have to be scheduled. The scheduling is important, right? If the object here is to take back some control in your day, you can't just pick stuff out of the day that you've already done and count it as a positive activity. To count, you must schedule it, then do it. So positive activities can be done alone or with others. They really don't require others to be successful, although having others along can enhance some activities. However, including others also complicates things. Will your friend show up? Are they excited about doing this as you are? Does having them along mean you're more likely to do an event? As you can see, there are pros and cons to having others involved. Positive activities can be brief, lasting only a few moments, or they can take all day. The power is in the scheduling and the doing. The length of the event is not as important as to whether you actually do it. To start, we're going to encourage you to make the activities small and easy to do. The larger the plan, the more places the plan can fail. So in the beginning, keep it simple and easy. As you gain experience and your mood is better, adding more complicated plans can help to keep your mood better as you anticipate the activity. Some examples of positive activities can be reading, going for a walk, listening to music, or helping out at your place of worship. More examples that caregivers report helpful are on the screen, and you can take a quick look at those. So if you were actually attending the session, we would do our attendance poll now, and we would take a 5-minute break. We're not going to do that We're just going to zip right through our break here. Okay. So how do we start using our positive activities to really start to elevate your mood? Well, the first thing we're going to do is we're going to make a list. So I'm going to ask you to pull out a pen and paper. There is no handout for this. You just need to pull out a regular piece of paper. And what I'm going to do is have you list things that you like to do that you're currently doing. As you can see on our on the screen right now, this person likes shopping, they like reading, they crochet, they like to sample new teas, they bake, they have lunch with friends, they play with their dogs. So these are all things that they do right now that's already kind of taking up their time during the day. So I'm going to go ahead and I'm going to give you 30 seconds or so, a minute, to write down your own things that you're currently doing. So you can stop the video and spend a few moments and go ahead and write those down. And then when you're done and you have, 5 or 6 things that you're doing right now, go ahead and start the video again. Okay, so the next thing I'm going to have you do is think about what you enjoyed in the past, right? Don't worry in the beginning whether you can actually do it or not now. What were some of the things you enjoyed doing in the past? So this person enjoyed golfing, painting, they like to sing, they went to museums, they went to church, they like to attend parties, they like to go hiking. So go ahead and stop the video and then start it again when you've got 5 or 6 items down of things that you used to do that you enjoy. And when we come back and you restart the video, we'll talk about how you can use those items now. Okay, so now you should have a list of a few things, of things you used to like to do in the past. And it may be that right now what you find is these activities, while you used to enjoy them, you really can't now and still attend to your caregiving responsibilities. Or maybe it's your own body that doesn't let you do the things you used to do before, right? We all get older and things change. Something to look at. Let's take golfing, for instance. Why did you used to like to do that activity? So this person used to really like to golf, right? What part of it is what gave them pleasure? Maybe it was being outside, right? It was a little bit of exercise. Maybe it was the fact that they went with another person and they enjoyed getting together and golfing with them. It wasn't so much the golfing, it was the actual, meeting up and joining with that friend. It may be that it was a test of their own ability, the fact that they could go out and practice something and get better at it each time. So depending on what it is, that may give you some insight to how you need to modify it, right? If you can't go out golfing for 18 holes anymore, maybe you can go out for an hour and go to a putting green with a friend and practice putting. So it depends on why you got enjoyment or how you received the enjoyment or why you found that activity pleasant or positive to begin with. And once you can tease that apart, maybe you can find other activities like that you can do now. Identify what makes it enjoyable. Find a way to keep the enjoyable part by figuring out what's stopping you, problem solve, and then make a plan and try it out. So as you see, we have a list now of things that you like to do that you're doing currently, things that you used to do in the past. Some of them you may still be able to do now. Some of them may need to be modified, but still might be able to do now, right? The next thing I'm going to ask you to think about is Are there things on your list that help you to stay active? And there's a lot of reasons why exercise or staying active really is important. Um, one thing we know as far as your mental health goes, that research has shown exercise can be as effective as taking antidepressants for the treatment of depression and the maintenance of a healthy mood. It's really important to note that it can help to maintain that happier or healthier mood, because there aren't a lot of things out there that can really encourage that maintenance once you've had these experiences of depression. We know that people who regularly exercise report improved sense of well-being. It's been shown to improve or maintain some aspect of cognitive functioning, like the ability to shift quickly between tasks. We call it multitasking when we're trying to do multiple things at once. And the idea is we shift from one task to the next task to the next task. We go back and forth until everything is completed. As we get older, that ability to shift back to the task that you were doing gets a little bit harder, but exercise seems to help that so that you can make that shift quickly. It's also been shown to improve your executive functioning. And these are things like, how do you plan an activity, right? The step-by-step process that you need to think about and do. It helps to remember the details. And not unexpectedly, exercise helps to improve sleep. It also helps with physical health. Research has shown us that people that consistently exercise, it can help to manage or even put off for a while things like arthritis, heart disease, stroke, type 2 diabetes, osteoporosis. And it shows improvements in 8 different types of cancer, including breast and colon cancer. So what kind of marathon do you need to run to get these types of benefits? It's really not that bad. The target for these benefits is 150 minutes or 2.5 hours a week of moderate intensity aerobic exercise. Figure that means about 30 minutes per day for 5 out of 7 days. And that 30 minutes can be broken up. You don't have to go all at once. You can do 10-minute walk in the morning, a 10-minute walk in the afternoon, and spend 10 minutes doing some other type of aerobic activity. It's important to note that even if you can't get in 150 minutes a day, that any movement is better than none at all. There are a lot of different things that can help to improve your health, but they all seem to have a dosage that you have to reach. Exercise, on the other hand, or staying physically active, is one of the few things that even if you do just a little bit, you improve your health. So when we talk about moderate intensity aerobic exercise, what do we mean by that? It's any activity that gets your heart pumping. A simple way to tell what moderate intensity means for you is that you can still talk, but you can't sing while you do the activity. There are some very complicated ways of figuring out what's your exact level of moderate intensity. And if you already know those and do them, that's fine. But the simple rule of thumb of being able to talk but not sing, that can be a good, easy rule to follow. If you're new to exercise, there's a URL or a web address down at the very bottom of the screen. I highly encourage you to check in. While it is meant for older adults, if you've been sedentary or sitting around a lot, especially through the pandemic, and you're just getting back to exercise, you should do 2 things. 1, check in with your physician and make sure that you're healthy to exercise. And 2, start slow, right? And increase your level gradually. The NIH government site has a wonderful website for exercise, physical activity that can really encourage you and walk you through the basics. So bottom line for your health, schedule in some activities that you enjoy that get your blood moving. So take a moment now, go back to your list and review it. Do you see things on there that can be considered an aerobic exercise? If not, are there things on there that you could do? You could add some ideas, right? It can be a walk or a hike. It can be things like dancing, if you like to dance. If you enjoy getting out and working on your lawn or working in the garden, there are many activities within gardening and within lawn care that can get your heartbeat going. So think about things that you enjoy that can help you to stay active and add those. Go ahead and pause the video and add those on, and then come on back when you're ready. Okay. Hopefully now you have a list of a few things, at least 10, but hopefully more like 20 items of things that you have found to be positive either currently or things that you have found positive in the past. In your pocket, you should be able to find something called the PAL, or the Positive Activities Log. On it, you can see a copy of it here on the screen. I'm going to ask you to pull that out. You'll see across the top, there's a list of places where you can put 10 activities. And then from day 1 to day 7, and that's going to follow your week. So under day 1, take a moment and put whatever is tomorrow's date down there. So if it's Thursday, go ahead and put Thursday. If it's a specific day, whichever makes it easier for you to keep track. Okay, so once you've done that, I want you to take 10 of your activities that you're most likely to do in the next week. And these can be activities that you do every day, right? A cup of coffee first thing in the morning, could be going out and listening to the birds sing out on your back porch. It can be taking an evening walk, maybe watching your favorite TV show. What are the things that you're most likely to do next week? Go ahead and list those from 1 to 10. Try and keep these simple and easy for this week. Okay, go ahead and write those in. If you need to, you can pause the video until you get all 10 activities transferred over. Okay, now that you've got all 10 activities transferred over, what I would like you to do is, starting tomorrow, I would like you to put a slash on any of the activities you're going to do tomorrow. The goal is to have 4 activities in your schedule per day. So go ahead. You can pause the video, and for the next 7 days, day 1, day 2, day 3, day 4, 5, 6, and 7, go ahead and schedule 4 of those activities for each day. Okay. Once you've got all 7 days scheduled, and remember, you can repeat, right? So if every morning you sit down and have that cup of coffee, go ahead and schedule that in. We don't have to put the time in, just what day you're going to do it. So at the bottom, you'll see the 2 grade lines, one that says the total number of activities done, and the other says mood score for the day. So during the week, you're going to take this schedule out. And at the beginning of your day, you're going to note the 4 activities that you said you were going to do that day. And hopefully you're going to do your darndest to get them scheduled into your day. At the end of the day, I want you to take a minute and just total up, which ones you've done. When you finish it, you can make the other slash and make an X for the ones that you finished, and just a slash for the ones that you scheduled but you didn't complete. the end of the day, I want you to go through and count all those X's. How many activities did you actually do? And then I want you to think about your mood for the day. You see a scale at the very bottom where 1 is very sad, 5 is so-so, and 10 is you're feeling very happy. And at the end of the day, I want you to just take a look at that and to think about it and give yourself a rating score for the day. So every day in the morning, you'll take a look at your activities, what you've scheduled for the day. During the day, you'll do them. At the end of the day, you'll total up the number of activities and you'll give yourself a score, for a mood score for the day. Now, it's important to note for the effective use of this skill, scheduling is a very important part of this process. Can't look back over your day and count the things you already did. It needs to be scheduled. Another very important aspect of this is not to wait to do things until you feel like doing it or wait until you're motivated to do it. Make the plan, follow the plan, trust in the process. So in other words, just do it, right? We're going to borrow Nike's little slogan there. Research has shown us that the best dose for the positive activities is 4 per day to reduce depressive symptoms. And then once you get rid of them or reduce them, to maintain their absence. So we're going to start you out with the goal of trying to get 4 positive activities scheduled into your day and then doing them. Now, for someone who hasn't had any positive activities in their day, 4 may seem really overwhelming. And it's important to note that what we're talking about here is not always the big elaborate, let's go to the opera kind of plans. Keep it small, keep it simple. What are some of the things that you do that you get meaning from, pleasure from, that you value? It may be that moment's peace that you get with that first cup of coffee. You can tell that's one of mine because I keep coming back to it. When things are totally chaotic, maybe taking a moment, turning the radio on and listening to music for a little bit can help you to kind of ground yourself again and to calm down and to just enjoy yourself for that moment so that you can then step back into your busy, chaotic schedule. Keep them short, keep them small. The important thing here is that you can actually do these activities that you're scheduling. You shouldn't have 10 aspirational items, right? If you've never exercised in your life, now is not the time to say that all 4 of your activities are going to be, I'm going to take a Zumba class and I'm going to go run a mile and I'm going to, do all of these things that may be incredibly difficult for you to do. So especially when you're experiencing many of the depressive symptoms, you want to make it doable and easy to plan and then execute. So it's important to note that this process that we've just given you, the using positive activities to elevate your mood, this can take a while. It's not going to happen overnight. It can take up to a month of deliberately scheduling positive activities. A lot of it depends on where you are in the moment, where your mood is in the moment. The reason this takes a while is you picked a random 10 activities. It may not be that those activities are the ones that lift your mood. So you're going to need to revise your lists. After the first week, take a look at your PAL, right? Your positive activity log. What activities were done? Which ones were not? Think about what actually stopped you from doing those activities. Can that activity be modified, right? If you did not go to lunch with your friends because there's one friend that while you really enjoy having her lunch, she's always the one that says, yeah, I'll come. And then the day before cancels on you, right? Can you go out to lunch with other friends, right? Ultimately, Do you need to switch it out for a different activity? Do you remember we made that list that had 20 some activities on it? Maybe you need to switch the one out that you didn't do with another activity. Your goal by the end of the month is to find 10 solid activities that you can use to lift your mood whenever you need it. So if you remember, I had you at the end of the day, the plan is that you're going to check your mood. And there's a good reason for that. Many times as we go through this over the month, you're going to notice that there are some supercharged activities. And these are activities that just seem to really elevate your mood, right? Whether it's talking to a friend on a phone that you haven't talked to for a while, or it may be just spending some time outside. These are activities that you know that you can solidly count on that really, really work for you, right? So we know that some activities work better for people than other activities do. Finding those activities and putting a little star by them, right? That they may help you when you don't have time to do 4 positive activities in your day and you only have time to do 1, making it one of those supercharged activities may help to elevate your mood just as much as if you had done 4 positive activities. So figuring out your dose and figuring out which activities work better for you than others is all part of this process and why it can take a little bit of time to do. So some of the things that we hope you take away today from this session is that depressive symptoms are common during caregiving. Taking the time to enjoy yourself can help you feel less stressed and a better caregiver. Scheduling and then doing positive activities can help to manage your mood. It's important to do the scheduled activity even if you don't feel like it. Make a plan, do the plan, trust in the process. Doing positive activities together among other activities with the person being cared for can help you to manage their mood as well. Making this work for you. So if you remember the end of last session, we had an action plan that we created together with you. Today, we're not going to have any choices. Today, everyone is going to plan to work on the positive activities. What we're going to ask you to do is to create that list of positive activities you had to start in this session, right? You're going to schedule 4 positive activities each day. Do the activities as scheduled, and at the end of the day, note your mood rating. Each week, revise your list until you have 10 solid activities that you can depend on. You're going to add activities to your schedule whenever you're feeling down or notice that you're getting irritable. So how do you go about you do this? Well, the first thing I'm going to have you do is to set a deadline, right? We want you to be realistic in that deadline. I'm going to encourage you to set a deadline that you're going to start your action plan tomorrow and that you're going to work at it for at least a month. Okay, so why do these positive activities, right? How will this help you? The more personalized you can make this motivation, the better off you're going to be and the more valuable it's going to be to encourage you to do the activity. So one good example is I'm going to, that I've been feeling really down and irritable lately, and that I'm snapping at everyone. So I'm going to try these positive activities. I'm going to see if it works, right? The more personal you can make this motivation, the more likely it is to be effective for you. Next thing I'm going to encourage you to do is to write down what you're going to pair it with, right? So you want to pair the recording of this, right, with something you already do. So when I have my morning coffee, I'm going to check the schedule. just before bedtime, after I brush my teeth, I'm going to sit down and I'm going to double check the schedule and mark off which ones I did, and then do the count it up and score my mood, right? You're going to pair it with something you already do. It's a built-in reminder. Now, sometimes, especially with something as complex as this, it may feel a little overwhelming to try and take this on. Then it might be easier to take the large tasks and break them down into different steps. You know, if you don't feel like your list of positive activities is complete, all right, that would be step one. What day are you going to be done by? When are you going to do this? Right? When are you going to sit down and schedule? If you didn't do it with the class or with the session here, when are you going to sit down and schedule your 4 positive activities? Okay. So sitting down and breaking down this one big task into little steps might be helpful to you. If you do that, make sure you put deadlines with them so you know you're going to get them done. And of vital importance are the reminders, right? How are you going to remind yourself you need to do this? Some people use phone alarms. Some people use Post-it notes. Some people will tape like the PAL to the refrigerator so they remember to do it every time they go to the fridge. It all depends on what your schedule is like and what you find is the most helpful way of remembering to do these activities. And finally, if you run into problems, how are you going to get it done? Well, the first thing you'll do is ID what the actual issue is, right? If you can't remember to look at the schedule, right? You don't remember what you're supposed to do each day. Right? What was the problem there? Why aren't you, what's happening? Is your morning just so chaotic that you got to get the kids out to school and mom needs her, medicines and things that feel really overwhelming in the first thing in the morning? Well, then maybe doing it with a cup of coffee in the morning isn't working for you. Maybe you need to review it the night before. Maybe you need to review it after the morning rush. Figuring out what the issue is and then figuring out different solutions and trying them out, right? And then if they don't work, going back, figuring and trying some of the other brainstorm solutions. These are easy ways to problem solve what the issue may be. Remember, if you have any questions or any problems, that you should contact your facilitator and have them help you work through this action plan. I'd like to remind everyone that the participants page on the website is available to them. If you'd like to know more information about what we talked about today, you probably already know it because you accessed the video from this page. If you go all the way to the bottom, you're going to find something called resources. Under resources are each of the session names. Go to this session and you're going to find a lot of helpful articles and web links and places that you can go to find more information about why this method that we taught you today is effective. Maybe a different presentation of it as well that might help you. So go ahead and take a moment and check it out. It is optional, you're not required to do so, but it may be helpful. Normally in session, we would have you complete a poll, but we can't have you do that right now. So I'd just like to say thank you for joining me. And again, if you have any questions, to please go ahead and talk to your facilitator. They'll be happy to answer any questions you may have. Have a nice day. Bye.